The effects of COVID-19 on American college students' level of test anxiety. Test anxiety is described as physical and mental stress symptoms that is caused by an upcoming exam. Anxiety and depression have been linked to lower educational achievement. Test anxiety may hinder the performance of a person taking an exam, which ultimately affects the student's success level. The first case of COVID-19 in America was diagnosed on January 20th of 2020. The COVID-19 pandemic caused a great change and a sense of uncertainty in the world. Uncertainty has been associated with increased anxiety, stress, and coping issues. Long-term isolation and mental health. The effects of long-term isolation on mental health were examined by a group of researchers. Their study measured mental status, behavioral patterns, risk perception, knowledge of stress management, academic pressure, family and peer relationships in students at a campus in Henan Province, China, who had been isolated for slightly over 2 months. The 2020 to 2021 school year was completed virtually as opposed to traditional style learning in most higher education institutions. This isolation may disturb relationships, social skills, motivation, and more. General mental health issues onset by COVID-19 survey studies. Several studies have been conducted to analyze the effects of COVID-19 on the general mental health of college students. A group of researchers aimed to assess the effects of COVID-19 on college students' mental health. The research findings come from an online interview survey focusing on the state of Texas. The study found that 71% of the students tested indicated an increased level of stress and anxiety as a result of COVID-19. A separate study, co-led by Boston University researcher Sarah Ketchman-Lipson, administered an online nationwide survey in the fall of 2020 that resulted in 83% of students identifying that their mental health had been negatively impacted in the past month. The survey's results led to examine the question of how students' success in academics was affected in the early 2020 to 2021 school year. Another group of researchers administered a standard questionnaire, self-designed coronavirus, pneumonia knowledge, and cognitive behavior questionnaire, a generalized anxiety disorder 7, and a patient health questionnaire 9, and an internet-based survey were all administered. The results of this study found that 69.47% of the college students tested have a strong awareness of COVID-19, and that 26.60% showed an incidence of anxiety and depressive emotions were found in 21.16% of the tested students. General mental health issues onset by COVID-19 comparative study. A comparative study was completed at a university in North Carolina. Data from 419 first-year students were compared before and after the COVID-19 pandemic began. This study found that moderate to severe anxiety increased from 18.1% to 25.3%, and that the prevalence of depression increased from 21.5% to 31.7%. Student athletes test anxiety during the COVID-19 pandemic. A more specific study to the current one was conducted in Chongqing, China, that investigated 556 Chinese high school student athletes using a TAS test anxiety scale, intolerance of uncertainty scale, perceived social support scale, and coping style scale for middle school students. The results of this study show that 56.5% of the tested students experienced an increase of test anxiety. This study examined Chinese high school student athletes specifically. The researcher recognizes that the study was conducted in one city in China and cannot be generalized to other Chinese cities as well as other countries. Hypothesis. I hypothesize that participants who report feeling heavily isolated during the COVID-19 pandemic will have had an increase of test anxiety. Previous research conducted has shown an increase in anxiety levels among college students. The lack of research on test anxiety presents the issue of missing information on the individual aspects of anxiety of college students. The current study was designed to examine the effects of the COVID-19 pandemic on the level of American college students' test anxiety. Design. This study will use a quantitative research method. The independent variables are the questions on each survey. The dependent variables are the respondents' answers to each question. Extraneous variables may include the different experiences each participant faced during the COVID-19 pandemic. Participants. The participants will be volunteer Brescia students with an age range from 18 to 24 years old. All participants will have completed at least one semester of higher education in America. Materials. Online anxiety tests will be administered to all participants. The participants will have the choice of completing the surveys on their own electronic devices or on a desktop computer that will be provided. Each participant will have access to Brescia University's internet services. The Coronavirus Anxiety Scale and the Westside Test Anxiety Scale will be administered to each participant. The Coronavirus Anxiety Scale is a 5-question online assessment that looks at an increase of anxiety associated with the COVID-19 pandemic. The Westside Test Anxiety Scale is a 10-question survey that uses a 5-point scale and assesses test anxiety levels. Procedure. Once the participants arrive, they will be debriefed and asked if they have any questions or concerns. All questions will be answered before any instructions are given. To begin, each participant will be asked to rate their level of test anxiety on a 5-point Likert scale prior to the COVID-19 pandemic. This scoring will range from 1 strongly disagree to 5 strongly agree. Each participant will then be asked to complete the Coronavirus Anxiety Scale. The Coronavirus Anxiety Scale scores on a 5-point Likert scale ranging from 0, not at all, to 4, nearly every day over the last 4 weeks. After the completion of the Coronavirus Anxiety Scale survey, the participants will then be asked to complete the Westside Test Anxiety Scale. The Westside Test Anxiety Scale scores on a 5-point Likert scale ranging from 1, not at all or never true, to 5, extremely or always true. Results. The initial rating of the test anxiety prior to the COVID-19 pandemic, the Coronavirus Anxiety Scale, and the Westside Test Anxiety Scale will be scored on a 5-point Likert scale. The final scoring will be calculated and placed into 3 categories: 2 to 6, little to no effect; 7 to 10, moderate effect; and 11 to 14, significant effect of COVID-19 on test anxiety level. Discussion. If the results of this study are as predicted, there will have been an increase of test anxiety in American college students due to the COVID-19 pandemic. The results will be compared to similar studies and will be discussed. The implications for individuals with increased test anxiety will be considered. Limitations to the current study and suggestions for future research will be identified. One limitation to this study is the generalizability of the findings to college students of other demographics. A second limitation is that this study will focus specifically on how the isolation period during COVID-19 affected the participants' level of test anxiety. Future researchers could broaden their study to multiple universities across America and account for extraneous variables. Thank you.